All right, when you're ready.
Welcome to the Kolender Medical Radio Show. I'm your host, Anne-Marie Cronin, here talking with Dr. Brian Kolender, board certified in internal medicine and specialist in artery disease, with offices in Bingham Farms and downtown Detroit. Dr. Kolender is here with us discussing his concierge practice and how to avoid heart attack and stroke, and how to begin the reversal of artery disease. Now, Dr. Kolender, welcome to the show, and let's talk about diabetes. Tell us what we need to know.
Well, thank you, Anne-Marie. First, I want to say welcome back to any of our listeners and welcome any new listeners. The goal of the show is to give you the tools and information to help you prevent heart attacks and strokes, which are 100% preventable. So we're going to talk about a lot of issues. Today, I do want to focus on diabetes. And when I started practicing in 1995, there was a bad omen of starting insulin. I remember patients were afraid to start insulin because that's when they died. They thought that if you started insulin, you were going to die. And we are also working on preventing you from dying from heart attacks and strokes. But I think that's interesting that this correlation, since then, so much has happened. We're better at diagnosing diabetes early, yet we're still dealing with heart attacks and strokes as being the number one cause of death. So heart attack is still the number one cause of death. Stroke is still the number one cause of disability for 100 years, yet we're diagnosing diabetes earlier. Why is that? Why are we better at treating cholesterol, better at treating blood pressure, although that's probably not true? Why are we better at diagnosing diabetes earlier and have better medicines, yet heart attack is still the number one cause of death? That's not changed.
Okay, but here's a question. Why is everybody getting diabetes?
Well, great question. And the reason people are becoming diabetic, and this is all in the last 40 to 60 years, this epidemic of diabetes, and the reason for that is, I'm going to say in a general term, environmental, and that includes what we're eating. In the last 40 to 60 years, we've been eating more processed foods. We're eating foods with more refined sugar, refined flour that have chemicals in them. And if you are eating too much and you're requiring your body to generate too much insulin on a regular basis, you're taxing your system. Now, I'm getting a little ahead of ourselves on this question. I want to back up a little bit, because to answer that question, we need to understand what causes diabetes.
Well, let me ask you another question. Is this more prevalent in this country than in other countries?
As countries become more westernized, they're having obesity issues, and they're also having an increased incidence of diabetes. So it's really our Western diet and lifestyle that's causing this increase in diabetes. And the irony and another misnomer that's occurring is people are looking at their parents who've been not eating healthy and not having a great lifestyle, and they go, well, this is how my parents are, this must be genetic. And it really isn't entirely genetic. Yes, there is a genetic component to becoming diabetic.
But can you inherit it or no?
If
your parents have it or one parent has it, what are your chances? Or is it just basically lifestyle?
There's a genetic component to diabetes, but as we'll discuss, the genetic component to a lot of these diseases are modifiable by lifestyle. So if you have a genetic predisposition to diabetes and you eat garbage, you're going to become diabetic. That's 100%. And if you're diabetic, you're going to have a heart attack and a stroke. That's 100%. But all of that is preventable. So,
okay, wait, I gotta ask you a question. So if you're going to see a primary care physician for a physical at least once a year, or you're getting blood tests randomly throughout the year, why don't they catch this in the sugar count, and why don't they stop you at a certain point and say, there's a flag here? Why don't we know about this before we get diagnosed with a disease?
Well, even now, we're better at identifying it early. How many people out there, show of hands, are been told they're pre-diabetic? And what I want to tell you is that being pre-diabetic should not make anyone feel comfortable. Being pre-diabetic is a very scary proposition because the process of becoming diabetic is called insulin resistance. And we talk a lot about inflammation being the driver of sudden death from heart attack and sudden disability from stroke. Insulin resistance is one of the major drivers of inflammation to our arteries. And if we want to stop, one of the things we got to stop and prevent heart attacks and strokes, we need to understand who has insulin resistance.
Who does? How do you get it? How do you become insulin resistant?
Well, most people actually have insulin resistance, whether they've been told they're diabetic or not, whether they're pre-diabetic or not. Well, I shouldn't say or not. If you've been told you're pre-diabetic or you're diabetic, you have insulin resistance. And whether or not you ever become diabetic and you have insulin resistance, your risk of disease, of having a heart attack or stroke, is still high because you have a driver of inflammation that's not being checked. And this is something we're going to talk more about. Again, we're going to talk a lot about diabetes this show and how to manage it.
I think we need to talk about what is insulin. And most people think that insulin is an injection that you get to manage diabetes. But anyway, we're going to have to take a quick break. In the meantime, you're listening to the Kolender Medical Radio Show. You can reach Dr. Brian Kolender by calling 248-737-0091. Again, that number is 248-737-0091. You're listening to the Dr. Kolender Radio Show on News Talk 760 WJR.